Welcome back, orthopedic enthusiasts. You're watching another episode of Back to Bone, where the pioneers of surgery speak again. Today's guest is a true innovator who transformed hip surgery. From the mold arthroplasty to the Smith Petersen nail and the anterior approach that's still used today, his work changed orthopedic practice forever. Dr. Marius Smith Petersen.
Good morning, and thank you. It is a true honor to be part of Back to Bone, Orthopedic Legends Reimagined. I am humbled by the recognition and pleased to share the story of my journey in orthopedic surgery. The opportunity to reflect on the innovations and ideas that help shape modern hip surgery is both meaningful and inspiring.
Your name is often associated with the mold arthroplasty and the anterior approach to the hip, but few people know about your early days as a ship surgeon. How did that experience shape your mindset as a clinician and innovator?
Yes, my early days as a ship surgeon. Few ask about that, but it was indeed a formative chapter in my life. Shortly after completing my training, I served aboard a hospital ship traveling through the South Pacific. The conditions were demanding: limited equipment, resource constraints, and a diverse range of injuries and illnesses. But it was precisely those limitations that honed my ability to think creatively and act decisively. Working in such an environment taught me that innovation often comes from necessity. I couldn't rely on ideal conditions or perfect instruments. I had to improvise, to adapt. That mindset never left me. It shaped the way I approached surgery throughout my career, not simply accepting established methods, but always asking, can we do this better? Can we make this safer, simpler, more effective for the patient? In many ways, the mold arthroplasty, the Smith Petersen nail, even my choice of the anterior approach to the hip all stemmed from that foundational experience, where necessity sparked innovation and where adaptability became the most valuable surgical skill I carried forward.
Tell us more about the idea about Smith Petersen Vitalium mold arthroplasty.
The idea for what became the mold arthroplasty began in 1923 when I was treating a young patient with tuberculosis of the hip. At that time, preserving joint motion was difficult, fusion was common, but it sacrificed mobility. I believed there had to be a better solution, something to relieve pain and maintain function. I first experimented with a glass mold made of Pyrex shaped to fit over the femoral head. The purpose wasn't to replace the joint, but to help it heal in a more functional position, reducing deformity and stiffness. It acted as a spacer, encouraging fibrous tissue to form and simulate joint movement. However, the glass wasn't durable enough. Over the following years, I refined the concept, and by 1937 we introduced a version made from Vitalium, a cobalt-chromium alloy used in dentistry. It proved to be strong, biocompatible, and resistant to corrosion, ideal for the mechanical demands of the hip joint. The Vitalium mold arthroplasty was a major step forward. While not a full joint replacement, it showed that covering the femoral head with a contoured, inert surface could relieve pain and restore motion. It shifted the mindset from fusing joints to preserving them, rebuilding instead of removing. That idea, simple yet powerful, became the foundation for future hip resurfacing and eventually total hip replacement. And it all started with a belief: patients should move again, not just survive.
In recent decades, surgeons like Eric de Witte have advanced the anterior approach, refining it into a truly muscle-sparing and efficient pathway. What are your thoughts on how this evolution builds upon your original vision and the possible impact on healthcare costs?
Thank you for the thoughtful question. It is both humbling and gratifying to see how the anterior approach, which I originally developed to treat hip pathology while respecting anatomical planes, has evolved so meaningfully. Surgeons like Dr. Eric de Witte have refined this approach with remarkable precision, making it more efficient and muscle-sparing while remaining true to the principles I held dear. My aim was always to preserve function by minimizing trauma, accessing the hip through an internervous and intermuscular interval, avoiding unnecessary disruption. Today, with advanced instruments and deeper anatomical understanding, this has been taken further, enabling faster recovery and earlier mobilization. The impact on healthcare systems is also significant. With hip arthroplasty procedures exceeding 450,000 annually in the United States and over 130,000 in Italy, there's growing focus on outcomes and cost efficiency. Modern anterior techniques have led to shorter hospital stays, from 3 to 5 days to just 1-2 days, and even same-day discharge in selected cases. This progress results in real cost savings, better use of resources, and improved patient experiences. It's deeply rewarding to see that the principles of anatomical respect, functional recovery, and patient-centered care continue to guide innovation in hip surgery today.
Thank you so much, Dr. Smith Petersen. This is the end of the 4th episode. Stay tuned for the next, where we'll meet John Insall.